In a lot of countries, falling ill comes wrapped in dread that has nothing to do with the illness itself. There's the worry about the cost, the long wait for an appointment, the maze of referrals, and the nagging sense that seeing a doctor will eat your whole day and your savings. In South Korea, getting sick is genuinely less stressful because the system is built around speed, access, and affordability in a way that quietly removes most of that dread. You can walk into a clinic without an appointment, see a doctor within minutes, pay a small fee, and pick up your medicine next door, all before lunch. It's not a flawless system, and locals are honest about its strains, but the everyday experience of dealing with a cold, an infection, or a minor injury is remarkably painless. Let's look at why getting sick in South Korea isn't the nightmare it can be elsewhere. The contrast hits hardest for people who grew up bracing for a fight with their healthcare system, because here the default assumption is that care will be quick, close, and cheap rather than something to dread. The first thing that strikes newcomers is how many small neighborhood clinics there are, tucked into nearly every block and commercial building. These local clinics, known as Yuan, specialize in everyday complaints, and you generally don't need an appointment at all. You simply walk in, register, and wait a short while. Because they're so densely spread across cities, there's almost always one within a few minutes of wherever you happen to be. This sheer availability changes the whole calculation of seeking care, because there's no barrier of booking weeks ahead or traveling far. When a doctor is essentially around the corner and open to walk-ins, you go early instead of toughing it out, and minor problems get handled before they grow. Many of these clinics keep long hours and cluster near subway stations and busy streets, so seeking care fits into an ordinary day instead of derailing it, and you rarely have to travel far or plan around limited opening times. Second, the cost is low enough that price rarely factors into the decision to go. South Korea's national health insurance covers residents, and a routine clinic visit typically costs only a modest out-of-pocket fee, often just a few thousand won, with prescriptions similarly inexpensive. You don't brace yourself for a frightening bill or avoid the doctor to save money. That affordability is the quiet foundation under everything else, because it means access isn't rationed by fear of expense. People seek care when they need it, catch issues earlier, and treat going to the doctor as an ordinary errand rather than a financial gamble they have to weigh carefully every single time. Because the cost barrier is so low, people don't gamble with their health to save money, and that single fact quietly shifts the whole culture toward catching problems early rather than letting them fester into something worse. That low cost isn't a minor detail. It's the quiet foundation under everything else, because when seeing a doctor doesn't threaten your budget, you simply go when you should. Third, the speed is genuinely impressive. Walk-in clinics tend to move quickly, with short waits and brisk, efficient consultations, so you can often be in and out within the same hour. There's no sense of losing an entire day to a single appointment. This efficiency is a relief precisely when you feel awful and just want to be seen, treated, and sent home to rest. Because the whole encounter is so fast, the friction of getting help drops to almost nothing, and that quickness, repeated across millions of visits, is a big part of why dealing with illness here feels manageable instead of exhausting. You aren't stuck losing a whole afternoon in a waiting room, and that briskness, multiplied across millions of visits a year, is a big part of why dealing with illness here feels manageable rather than draining. Fourth, pharmacies are everywhere, and pharmacists play an active, helpful role. After a clinic visit, you usually fill your prescription at a nearby pharmacy in minutes. And for minor ailments, you can often go straight to a pharmacist for guidance on over-the-counter remedies. They package your medicines clearly, explain how to take them, and are easy to reach. This tight, convenient loop between clinic and pharmacy means treatment doesn't stall after diagnosis. You get your medicine right away, with clear instructions, and that seamless handoff is one of those small conveniences that makes the entire experience of being unwell noticeably smoother. The pharmacist often becomes a first stop for minor issues, dispensing advice along with carefully packaged doses, so the loop from feeling unwell to holding the right medicine can close in a matter of minutes. Fifth, you can often go directly to a specialist without fighting through a referral system. Need a dermatologist for a skin issue, or an ear, nose, and throat doctor for a stubborn cold? You can typically just book or walk in. This direct access removes a frustrating layer of gatekeeping that, in some countries, traps people behind weeks of waiting before they can see the right expert. Being able to head straight to the doctor who actually handles your problem saves time and worry, and it means specialized care isn't some distant, hard-to-reach resource, but a normal, available option for ordinary complaints. Being able to head straight to the doctor who actually handles your problem, instead of waiting weeks behind a referral, means specialized care feels like a normal option rather than a distant resource reserved for serious cases. The result is that getting the right expertise feels routine rather than like a privilege you have to fight the system to unlock. Sixth, tests and imaging are frequently handled quickly, sometimes within the same visit, with results that come back fast. Rather than scheduling a separate appointment days later for basic diagnostics, much can be done on the spot or nearby with little delay. This compresses the whole arc of figuring out what's wrong, so you spend less time in anxious limbo waiting to find out. Fast diagnostics mean faster treatment, and that responsiveness, knowing you'll likely have answers soon rather than after an agonizing wait, takes a real psychological weight off the experience of being sick. That compression of the whole diagnostic arc, test, result, treatment, into a short window spares you the anxious limbo of waiting days to learn what's wrong, which is often the most stressful part of being unwell. Seventh, care that can be costly elsewhere, like dental work and vision, tends to be more accessible and affordable here, and the country is well known for an abundance of dermatology and aesthetic clinics too. Routine dental checkups, glasses, and skin treatments are widely available and reasonably priced, so people keep up with them rather than postponing out of cost. This broad accessibility extends the easy care feeling beyond just colds and infections into the kinds of maintenance many people elsewhere neglect, which means small issues across the board get addressed before they ever turn into bigger, more expensive ones. Because these treatments stay affordable, people keep up with the routine maintenance that many elsewhere postpone, so small problems across dental, vision, and skin get caught long before they grow into costly ones. Eighth, the system has embraced convenient digital tools. Booking apps, reminders, and modern administrative systems make scheduling and managing visits straightforward, and many clinics and hospitals run smoothly with efficient check-in and record-keeping. Technology smooths the edges of the experience, cutting down on paperwork and confusion. In a country comfortable with apps running daily life, healthcare logistics fit naturally into that same effortless digital flow. So arranging care is just another thing your phone helps you handle quickly rather than a bureaucratic chore that drains your patience. In a country where apps already run daily life, slotting healthcare logistics into that same effortless digital flow means arranging care is just one more thing your phone quietly handles rather than a bureaucratic ordeal. Ninth, hospitals offer a kind of one-stop convenience for more serious needs. Larger facilities bring many departments together under one roof, with pharmacies and services close at hand, so complex care is coordinated in one place rather than scattered across town. For anything beyond a simple clinic visit, this concentration of resources makes the process less daunting. You can move between departments, tests, and prescriptions within a single building, and that integrated design means even bigger medical situations are navigated with less running around than you'd face in many other systems. Moving between departments, tests, and prescriptions inside a single building means even bigger medical situations involve far less running around town, so the more serious moments feel coordinated rather than chaotic and scattered. Pharmacies sit right beside these facilities, so even a more involved visit usually ends with you walking out medicine in hand. 10th, emergency care is fast and reachable, with around-the-clock emergency rooms and a quick-responding ambulance service summoned through a well-known number. When something serious happens, help comes promptly. That said, this is where honesty matters most. Like many countries, Korea has faced real pressures lately, including disputes and shortages affecting doctors, crowding in emergency rooms, and thinner coverage in rural areas. The system isn't perfect, and those strains are genuine. But for the everyday illnesses and injuries most people actually face, the baseline of fast, affordable, accessible care remains strong. These strains are real and worth naming plainly rather than glossing over. But for the colds, infections, and minor injuries that make up the vast majority of actual visits, the baseline of fast, affordable care holds up remarkably well. Put it all together, and you can see why getting sick in South Korea simply doesn't carry the same fear it does in many other places. The clinics are close, the visits are cheap, the waits are short, the pharmacies are everywhere, and the specialists are within reach. None of this means the system is without challenges, and it's right to acknowledge the strains it faces. But for the ordinary business of being human, catching a cold, twisting an ankle, needing a prescription, the experience is about as painless as healthcare gets. And that's a quiet luxury people here often only appreciate fully once they've lived somewhere else. It's a quiet luxury that people here often only fully appreciate after living somewhere else, where a simple illness can mean a long wait, a confusing maze of referrals, and a bill that lingers far longer than the symptoms.